Well, heart disease is the leading cause of death in Mississippi, accounting for a third of all deaths in the state. But prevention efforts and state-of-the-art treatments are saving lives. To help bring more awareness as part of American Heart Month, Singing River Health System Cardiothoracic Surgeon Dr. William Smith joins us now with more. Dr. Smith, thanks so much for joining us. And of course, it's always troubling to see Mississippi at the top of the list when it comes to heart disease. But thankfully, there are better treatments and prevention efforts are helping people too, but it's not always easy to get people to follow those.
Yeah, that's right. It's a struggle anywhere in the U.S., but we're particularly affected down here.
Well, tell me a little bit about how things have improved. I know that Singing River has a lot to offer in terms of diagnosis and treatment, and of course we've come a long way, and even in recent years.
Well, sure. I mean, we recently moved to expand our cath labs to be able to provide care for more patients. We now have 5 up and running, 2 in Pascagoula, 2 in Ocean Springs, and now our newest one in Gulfport. And that's led to at least 100 patients a day getting diagnosed and treated for their coronary disease in the cath lab. And yeah, go ahead.
Yeah, and Dr. Smith, I would think that one of the keys is developing a good relationship with a cardiologist at some point. Should people wait until they have a problem to find a cardiologist, or at some point should someone have a baseline even if they think that they are in pretty good health?
Well, I think the most important thing is just to pay attention to your body. You know, they say 3/4 of heart disease has typical symptoms. That means another quarter doesn't have typical symptoms. So typically if patients are having chest pain whenever they're getting active, or shortness of breath whenever they're getting active that limits what they can do, that's a reason to get checked out. And chest pain that starts up, especially in the middle of your chest and moves to anywhere else in your body, but doesn't go away, is really a reason to get checked out urgently in the ER.
Sure, and also important to remind people that women are at risk too. We're learning more about that, and still though, it seems that because in some instances the symptoms are different, that it's often overlooked in women.
Yeah, that's what we tend to see is women have a little bit different symptoms. They most commonly still present with the same symptoms we talk about with the rest of the population, though, with the chest pain or shortness of breath being the thing we can attribute to their heart.
And you are saving more lives, right? I mean, the technology is making a huge difference, so we do have a lot of people who end up needing this care.
Well, I mean, of course, we've expanded our program here. We have the only hybrid operating room where we can do the structural heart programs here on the Gulf Coast. That includes MitraClip, which is a way to fix up somebody's heart valve if they're too high risk to have heart surgery. And we have a transcatheter aortic valve replacement, which is really now for any risk level patients that need their aortic valve replaced who don't have other reasons that we would need to do surgery to fix something else on their heart.
All right, cardiothoracic surgeon Dr. William Smith from Singing River Health System, thanks so much for joining us today.
Thanks for having us.